Now what is this RTPCR? Now they are pushing into that it can make out a variant. What is all this mess about variants diagnosed with RTPCR is, first of all, once you get a viremia or once you are infected, you will come to the doctor. The doctor in earlier days they used to do a rapid test, which is an antigen test. This is there during this period the patient comes to you, and during that phase when the antigen test or rapid test is positive, we are subjecting them to RTPCR. So now they have removed the rapid antigen test and they are going for a directly to the RTPCR. RTPCR will not give you the infectivity. Okay, this will is nothing but only whether it qualitative test. It doesn't give you the how much is the viral load. You have to correlate with the viral load. How much is the viral load? 6.7 log copies per ml. Then only we can say the patient has a very significant viremia or infective period, that infection is there in the body. Only during that phase, the therapeutic value is there. So it doesn't correlate with the viral load. The third is the variants how they came out is after the COVID infection. Earlier they used to give only COVID positive or negative. Because some Delta variants have come out by gene sequencing, they have found that they have correlated back with the RT-PCR. So they have, where you target here you target as you can see the virus. The first the antigen that was targeted was the spike antigen. RT-PCR was based on the nucleic acid of the S protein. So you have a S antigen. Because this was going for mutation and variability, then they have gone for the nucleic acid because this is a constant. So you have a N antigen, and then you have a envelope antigen. So and with the RP antigen. So if you read a RT-PCR test nowadays, earlier days it was only positive negative, whereas now we are having 3 antigens. One is about the nucleic acid, second about the RT-RP, third is about the envelope. And now there was some beautiful people are saying just because there are 3 are positive means Delta. If 2 are positive, it is Omicron. It's not like that. These gene sequencing has to be done, and viral load has to be done. After gene sequence only, you have to reinterpret it back to the RT-PCR. So now in addition to this, what is this omicron? Now the Tata company has come out with the RT-sure. The thing is, because the S protein goes on multiple mutations, there will be a target failure. This is called SGTO. Because the S protein become negative, so your RT-PCR test will come out like this. Envelope is positive, nuclear N is positive, RDRP is positive, but the S protein is negative. So it is Omicron. It is just a correlation. Just because based on the RT-PCR, you should never give a cocktail antibody. It has nothing to do with the infectivity. Infectivity is only made out with gene sequencing and viral load. And most important is our inflammatory markers. Without all this into correlation, the corporate or somebody in the corporate doctors or somebody has started this pumping monoclonal antibodies to everybody. This is a very, very false information which is being spread and very dangerous thing that to be done. So today the topic is role of RT-PCR in the diagnosis, how to make out the variants, and any role in giving a cocktail antibodies. So RT-PCR has a very, very limited role. I want to tell you again. So tomorrow I will be telling you about RT-PCR and the evaluation of the life cycle of the virus.